Controversial decision by St. Peter's Health Partners to close the Burdett Birth Center in Troy, Rensselaer County's only remaining maternity unit, was the subject of a forum by St. Peter's tonight.
But unlike the September forum at Sage College held by Attorney General Tish James that lasted for nearly 6 hours and took statements in person from women who used Burdett services, first responders worried about an increase in ambulance calls, and politicians from both parties who decried the cuts to women's health care, the only voices heard in tonight's online forum were from St. Peter's.
The president and CEO of St. Peter's Health Partners, Dr. Stephen Hanks, says that they do understand the impact the closure would have on the city of Troy, patients and the staff. They now expect it will happen in the first half of 2024.
St. Peter's cites multi-million-dollar losses at Burdett and declining birth rates as the reasons for the closure. While prenatal and postnatal services would remain in Rensselaer County, a major concern for patients is transportation for labor and delivery outside their home county.
If patients are not eligible for Medicaid and they still are not able to secure transportation, St. Peter's Health Partners will arrange travel through Uber, round trip, and or Tech Valley, which is available 24 hours a day, 7 days a week. We have also committed to hiring a transportation specialist who will partner with the MOMS program to solely focusing on transportation issues for patients.
Another major concern that came up during the question and answer session this evening as viewers of the forum typed in their questions, which were asked by a St. Peter's employee, was the type of care they would receive at St. Peter's versus the Burdett Birth Center. Would the midwifery model of care be supported?
This collaborative model has given us some really great statistics at Burdett. We've spent many years building that model, and we don't want to lose it. So we'll do everything we can to continue that model of care.
When it came to questions of space and staffing, the senior vice president of hospital operations said they're in the middle of refurbishing the labor and delivery unit at St. Peter's and will be able to accommodate the 2 to 3 births they're expecting to add per day. Viewers of the online forum whose questions were left unanswered will have responses on St. Peter's website, and a recording of the forum will be made available as well. But Dr. Hanks said no additional forums are planned, and St. Peter's will shortly be submitting their closure plan to the Department of Health.